My name is Danny Wedding. I'm a clinical psychologist, retired from the School of Medicine at the University of Missouri in Columbia, and more recently, I was Associate Dean for International Programs for the California School of Professional Psychology with oversight responsibility for psychology graduate training programs in Hong Kong, Tokyo, and Mexico City. I am also the senior editor for the book series Advances in Psychotherapy, Evidence-Based Practice. There are about 61 books in the series. My associate editors are Linda Sobel, Jonathan Comer, Ken Friedland, and Kim Penberthy. We're very, very proud of the books and think that they really do make a difference.
Hello, my name is Dr. Christine Weckerly from McMaster University in Ontario, Canada. I'm in the departments of pediatrics and psychiatry and happy to be talking to you today about our book, Childhood Maltreatment. Our book, Childhood Maltreatment, authored by myself, as well as David Wolf, Judith Cohen, Daniel Bromberg, and Laura Murray. We have all backgrounds in clinical psychology, psychiatry, and forensic work. We have come together to put a evidence-informed practice, trauma-informed practice approach to childhood maltreatment.
Hello, my name is Dr. Richard McKeon. I'm a clinical psychologist and public health official. I've worked as a suicidologist for 30 years. I have worked in psychotherapy, in emergency and crisis services, as well as in national and international policy work in suicide prevention. I am also the author of Suicidal Behavior.
Hello, my name is Laura M. Dickey. I'm a board-certified counseling psychologist and a co-author of the book Affirmative Practice with transgender and gender diverse clients. My co-author is Jay Puckett. Jay is an assistant professor at Michigan State University in the Department of Psychology and also works in clinical practice at Wild Ferns in the Lansing area.
I'm so pleased that 2021 World Mental Health Day is shining a spotlight on gaps and an unequal world. It is so important for us to realize that trauma and violence affects kids across the world, but some kids are even more severely impacted because of situations of war, poverty, political unrest, different sorts of things that happen that have really nothing to do with their decision making. And we need to support kids' rights. They have a right to have a life, a childhood that is free of violence and allows their participation in education, in well-being, in health, in basic necessities. And so often, trauma and violence come at intersections. And this year, we're acknowledging that and wanting to really pull all the different sectors, practitioners, advocates, policy people together to come together on behalf of children and adolescents globally today.
Mental health in an unequal world is a fitting theme for this year's World Mental Health Day. Transgender people are among the highest group of people who experience discrimination and violence in all aspects of their life, whether it be the workplace, school, seeking services from medical or mental health providers, or just trying to go about their day. Trans people are often at a heightened sense of self-awareness so that they can be sure that they can respond to however they might be assaulted or mistreated by somebody in their life. This heightened awareness or hypervigilance takes a toll on trans people. It would take a toll on anybody. And being able to respond to the challenges and differences and difficulties that people face on a day-to-day basis has an overwhelming responsibility for trans people and others who love and support them.
The upcoming release of the second edition of my book, Suicidal Behavior, attempts to identify and address some of the inequalities associated with suicide deaths and attempts. While suicide is a personal, family, and community tragedy all around the world and across most of the lifespan, there are inequalities. There are groups that have higher rates of suicide than others, and that need to have suicide prevention strategies that are focused on their unique patterns of risk and protective factors. What may lead to suicide risk in a young Black child in the inner city may be very different from that which may lead to heightened suicide risk among an older white male in a rural community. It's important to take these factors into account, whether we're talking about American Indian, Alaska Native youth, LGBTQ youth, or those with serious mental illnesses such as bipolar disorder, schizophrenia, or major depression that puts those individuals at heightened risk. And there are significant inequalities around access to the care that people need that we have to pay close attention to as well.
Every volume deals with multicultural issues, and we are proud of the fact that the books have been translated into over a dozen different languages. We've got some remarkable books coming up. A number of the books have been translated into second editions, such as Mitch Earlywine's book on substance use disorders, or this book on bipolar disorder, and this book on schizophrenia. So we do try to keep the volumes current, and problems like gambling, alcoholism, bipolar disorder, schizophrenia, and substance use problems are found around the world. So we think that we are making a difference in the world.
Our book addresses how to close the inequality gap with trans people by providing current, relevant information about how to work with this population. Although oftentimes a trans person may come to seek care for reasons that are unrelated to their identity, that doesn't mean that they don't face challenges on a day in and day out basis that we as mental health providers can help address. This book covers topics such as minority stress and its implications for suicide risk in trans people, letter writing. Often nobody has really clear resources about how to write a letter. Not only do we talk about the process, we also provide sample letters in this book that will help providers to be able to respond to their trans clients who need a letter of referral, whether it be for surgery, a name change, initiation of hormones, or some other aspect of their life. Additionally, we cover assessment and ways to do that in a way that is both culturally competent and doesn't unnecessarily victimize, if you will, the trans person and their experiences. We hope that this book will be a resource for years to come in how to work with trans and gender diverse people, recognizing that there are aspects of our work that change from one year to the next. And we hope that you will not only enjoy the book, but be able to apply the recommendations to your own clinical practice. Thank you.
Our book addresses the inequality gap by highlighting the role and toxic stress associated with adverse childhood events, or ACEs, as well as talking about the important resilience that youth in adverse contexts are experiencing different types of adversity experience. In talking about resilience, we are really putting emphasis on the important role of resources. Particularly with disadvantaged youth, we need to actually work on and provide financially resources so that we can galvanize their internal resilience that is always there with external resources. This includes in our book exposure to evidence-based practice, where we have a very thorough section on trauma-informed care, trauma-focused cognitive behavior therapy, as well as best practices in assessment of maltreatment and trauma, and how we can move forward in a strategic and effective, empathic and compassionate way to support youth, children and youth, or adults who are disclosing their childhood maltreatment to us. And the bottom line is every victim deserves and hopes for an empathic response. And every practitioner hopes to provide compassionate care. Our book, Childhood Maltreatment, helps with that in focusing on the very significant risk factor of maltreatment, a real global public health issue. Thank you.
We have volumes that are coming up dealing with the opioid use problems and borderline personality disorder. The Borderline book is written by Martin Bohus, and it has already appeared in a German version, and we translated that version into English for an English-speaking audience. Laura Dickey and Jay Puckett are writing a book that will soon be published in dealing with affirmative counseling with transgender and gender diverse clients. So we have lots of new books that are coming out. We aim to publish about 4 books a year, sometimes 5 books, sometimes 3. But the series has made a difference. It's made a difference in the way that clinicians treat their patients. And we like to think that the books include all the science you can pack into 100 pages. We adhere to the same goals as the Society of Clinical Psychology, which involves making sure that clinicians are using evidence-based approaches, and we like to think that our books reflect the best available evidence. We like to think we're making a difference in psychology, in clinical psychology in particular, and we like to think that we are helping address the problem of mental health in an unequal world. If you would like to learn more about the series, go to the Hogrefe website and simply in the search bar type in Advances in Psychotherapy, and you can pull up descriptions of the 61 books that have been published or are in press or being written at the current time. And we're always looking for new authors and new topics. If you would like to recommend a book for the series or an author for the series, drop me a note at danny.wedding@gmail.com. Thanks for your interest. I have found the books rewarding. I've learned a lot. I read every one of the 61 volumes, and I hope you find them as interesting as I do. Good luck.